Now, some leading health professionals have called for a parliamentary inquiry into the use of statins amid uncertainty that the cholesterol-lowering drug is benefiting patients. More than 8 million people are prescribed statins in the UK. The group says there's a lack of transparency around their usefulness. Well, cardiologist Dr. Aseem Malhotra is here. Good to see you.
Good morning, Steve.
Look, so many people take statins. They do lower certain levels of cholesterol, don't they? So what is the issue here?
Absolutely, Steve, they do. So just to put things in context, the global campaign to lower cholesterol through diet and drugs over the last 2 to 3 decades has failed to curb the global pandemic of heart disease. Not just has it not just failed, and I'll explain why in a second, but actually now in the UK, for the first time in 50 years, we're seeing an increase in heart disease. And one of the reasons for that is that the cholesterol theory itself is fatally flawed. So it was believed from studies going back over many decades that lowering cholesterol would reduce the risk of heart disease. Now, statin drugs have been used in that fight, and one of the reasons that they haven't really globed that pandemic is because their benefits have been overhyped. So just for example, Steve, in populations, if you look at populations, you look at clinical trials, albeit industry-sponsored, pharmaceutical industry-sponsored trials, so they come with an element of bias, of course. If you look at how much life extension you would get from taking a statin, even people with heart disease over 5 years, it's 4 days. Now, most doctors and patients are not told this. Now, on a separate side, you look at the side effects issue. And a lot of these clinical trials seem to have underreported or given information to doctors to make clinical decisions that side effects are very rare. The reality is, irrespective of exactly how prevalent they are, and I'll give you my view on this in a minute, half of people prescribed the drugs, we're going back over 2 decades, at least half will stop taking it within 2 years. And when you ask patients why, it's because they get side effects. Now, that's a huge number of people who are stopping a drug, which even in selected patients that take the drug, the benefits are still quite marginal.
So are you saying, though, that lowering cholesterol has nothing to do with heart disease? So well, these people are taking this drug needlessly?
It's a bit more complicated than that, Gillian, but actually, in essence, yes. It's about actually how the cholesterol is involved in heart disease, but not in the way most people believe. It's all about the profile of cholesterol. You have good cholesterol, bad cholesterol, for example. And then it's also ignoring the most important risk factor for heart disease, which is something called insulin resistance linked to excess body fat, in simple terms. But what's actually happened, in my view, is actually the mass prescription of statins has been a public health disaster, because actually what it's done is it's driven and increased people getting insulin resistance, because the low cholesterol, low fat theory that's gone along with that most people fear, has driven increased consumption of, in particular, sugar and refined carbohydrates. So in my view, actually, the mass prescription of statins and that philosophy behind it is actually a root cause of the type 2 diabetes and obesity epidemic.
You see, people are going to be very confused, and I'm sure many medical professionals are going to be confused. But you had a story only the other week about, poly pills, which, potentially sort of more for areas without the sort of level of healthcare we have in this country.
Sure.
But those poly pills contain statins, and they're saying, well, this is almost a miracle pill.
Yeah, so it's interesting about the poly pill. The poly pill, I think, has aspirin, it has a blood pressure lowering, a statin. The question is what bit of that has actually helped patients. But when you break the data down to its moving parts, Steve, still, the benefits are still very marginal. And what we advocate for, one is an investigation to really get this out in the open so that doctors and patients can make informed decisions. Because even if those benefits are small, tell the patients that. Because ultimately, a lot of patients who are coming to me, some of them getting side effects that are really unacceptable, which are commonly, muscle aches, fatigue. And in fact, there is evidence now, which doesn't get much publicity, that shows that a huge proportion of people are at risk of getting side effects from statins. So high-dose statins, if you're over 70, if you have a low body mass index, if you do too much exercise, if you're vitamin D deficient, the elderly, these are the people that are most vulnerable, and they're not going to get much benefit. And in fact, what that does, it increases more stress on the system. So recently, as you know, NHS England have announced that pharmacies are going to be dishing out high-dose statins without prescription. Now, I've written to Simon Stevens, the CEO of the NHS, and actually said, I think this will be a public health disaster, because what's going to happen is you're going to prescribe these drugs that are going to be given to people that aren't going to get any increase in life expectancy. And let's say 30% of them get unacceptable side effects, which are very wide-ranging. They're going to end up going to their GP with these side effects, not knowing it's a statin, and end up going through all sorts of investigations. I've seen people going for...
Very quickly, though, I mean, there'd be people worried watching this on statins. What would you say to them?
I think you need to make an informed decision with a discussion with your doctor and ask your doctor exactly what benefit am I getting, what are the potential harms, and then make a decision about taking the drug. But really, the whole benefits have been overhyped. In my view, it's really been one big cholesterol con, if you like.
Aseem, good to talk to you,
Thank you.
as always. Thank you.